Today we are covering the newborn assessment, a critical skill the NCLEX will absolutely test you on. The exam isn't just about knowing the steps, it's about identifying what's normal versus what's an emergency. Let's start with APGAR scoring. The exam loves to trip you up here by asking what the score indicates. Remember, APGAR evaluates the newborn's transition to extrauterine life. It does not predict future neurological outcomes. A score of 7 to 10 is good. 4 to 6 requires some intervention like stimulation, and a score below 4 is a critical situation requiring resuscitation. A common question will present a scenario, like a newborn at 1 minute of life who is crying, has a heart rate of 140, shows some flexion of the extremities, grimaces when suctioned, and is pink but has blue hands and feet. You must break this down. The cry means good respiration, so that's 2 points. Heart rate over 100 is 2 points. Some flexion is 1 point for activity. The grimace is 1 point. Acrocyanosis, the blue hands and feet, is normal and scores a 1 for appearance. This gives you a total of 7. The trap is seeing blue and marking down appearance more than necessary. Central cyanosis, a blue trunk or lips, would be a 0 and a sign of distress. Next, let's focus on the physical assessment, specifically the head. The NCLEX loves to test the difference between caput succedaneum and cephalohematoma. A question might describe swelling on a newborn's head that extends across the suture lines. This is caput succedaneum, which is just edema from birth canal pressure and resolves in a few days. If the swelling is described as a collection of blood that does not cross the suture lines, that is a cephalohematoma. This is a crucial distinction. The shortcut is to remember that caput crosses suture lines. Both start with a C. This simple phrase can save you on an exam question. Moving on to vital signs. The NCLEX will give you numbers and expect you to act. A normal newborn heart rate is 110 to 160 beats per minute. Respirations are 30 to 60 per minute. A respiratory rate of 70 is not normal and requires intervention. A common trick is to describe periodic breathing, where the newborn has brief pauses in breathing for 5 to 10 seconds. This is a normal finding. Apnea, which is a pause longer than 20 seconds, is abnormal and a critical finding you must report. Finally, let's discuss reflexes. You need to know the normal ones. A question might state that a 12-hour-old newborn does not exhibit a Moro or startle reflex when the nurse makes a loud noise. This is a red flag. An absent Moro reflex could indicate a brachial plexus injury from a difficult birth or a central nervous system problem. The exam expects you to identify this as an abnormal finding that requires further assessment and reporting. Another example is the Babinski reflex. Stroking the sole of the foot should cause the toes to fan out. An absent Babinski reflex in a newborn is an abnormal finding. The entire focus of the newborn assessment on the NCLEX is separating the expected, normal findings from the signs of distress or congenital abnormalities that require your immediate action as a nurse.